Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Bonnie Sheeren. Good morning.
Good morning.
So Bonnie's with Houston Health Advocacy. Today, we're going to be talking about navigating aging, advocacy, access, and empowered care. That sounds like a little mouthful, doesn't it?
Yes, it does. Yes, it does.
So let's kind of start off with, let's start off simple. What are the most common healthcare challenges that older adults face, and how can advocacy help bridge those gaps?
Well, that's not too simple.
It's supposed to be a softball. That wasn't a softball.
Yes, yes. I'm sorry I cut you off there, but when I started hearing, aging and healthcare, the biggest thing is it's hard enough for a lot of us to manage our own healthcare. The biggest thing is, portals. The big thing is now healthcare is moving online. And most of our elderly family members are not online. That's not their generation. They don't know that. So basically, what I do for a lot of my clients, as well as my elderly family members, is I manage their portals for them, which means I get tons of notifications that are including my own notifications for my own portals. But, I manage their portals for them, and, I can see what's going on, manage appointments, things like that. And it's just, the problem is, it's called comorbidities as we get older. There are just so many different things, complexities as far as medications. You got to watch polypharmacy, there could be too many medications going on. There needs to be a review done, at least once a year to make sure they're not taking too many medications. I mean, it's a high maintenance type situation. Also, if you can merge those portals together, there's a platform called Primary Record that I recommend. It will tie all the portals together, even though they aren't the same type of portals, same type of platforms. And you can let other family members look at that platform as well, so everybody's on the same page.
Nice.
But it takes some work.
Yes.
Work. I mean, I have a primary record account. Have I set my own up? No, I have not. It's like the shoemaker's kid, having no shoes. But I will one day. One day I will. But
yes, so that's good. So, one of the things that families also always usually have problems with, and I noticed this, even back in the day, a long time ago when I was reading through my grandparents' stuff, managing complex medical bills, because, when you get the Medicare statements, they're not the easiest things to read. And so how do you help families navigate that kind of thing?
Well, for one thing, everybody should, if your elderly loved one has not set up their Medicare portal, set it up for them and put yourself as a representative. If anybody goes on Medicare, if they're tech savvy, they should immediately put like 3 or 4 different family members or friends as representatives. You do not want to be the only person on your Medicare portal. You need other people to be able to speak to Medicare for you, or to be able to access that portal for you and be able to check it, because there's Medicare fraud, there's Medicare claims that get tangled up, there's all kinds of things that get problematic. And the complexities, Medicare's pretty straightforward, if it covers it or it doesn't cover it. The things that you get into problems with is, if it doesn't cover it, like with Medicare Advantage, that's when you get into a lot of denials, and that can be problematic. And that's where you get into calling people like us, like patient advocates, where we go and we fight with the Medicare Advantage people. Yes.
Yeah, they have great commercials, but we tell clients you don't want it.
Well, there's a caveat to that, but we'll get into that.
And so, so speaking of that, when they're thinking about, do I do Medicare and a supplement or Medicare Advantage, how do you help them through the options? Because in my practice, we don't see a lot of wins on the Medicare Advantage, versus the Medicare supplement, so.
So here's the thing. So if someone is like, if they are like traveling and still going, very active and very definitely if they're traveling, because, original Medicare is accepted everywhere and the supplement will cover everything else everywhere they go. Also, if they are going to, if they are eligible for aggressive treatments, for instance, like chemotherapies and radiation therapies are going to be outpatient treatments. So those are going to be Part B, and those are going to be only covered 80%. So like I had somebody who was getting outpatient chemotherapy at MD Anderson, $50,000. So it was covered, totally by their Part B plus their supplement, but they were eligible to have it. Now, if somebody gets into their 80s and they're frail, they're really not eligible for very aggressive type treatments of some sort, or like a proton therapy or chemotherapy or things like that. If they're very frail, I mean, I don't think any doctor is going to recommend it at that point. There's certain surgeries that their doctors are just not really going to be very liable to recommend, because it's very the frailty of the person. In that case, maybe Medicare. I have a elderly family member that has Medicare Advantage. It works very well for them. They're very frail. They're not going to go in for any kind of super aggressive treatments of any sort. They're not going to travel. They're not going to, they don't take many medications. They just need some basics and that's it. So Medicare Advantage can work for somebody like that because they only pay like $171 a month on their, and that's pretty good for them. I mean, that's great. And I mean, for somebody to pay, their Part B plus their supplement, when they really will not be getting like some major treatments down the road due to their age and due to their frail condition, it kind of makes sense maybe to switch over to a Medicare Advantage. But
Okay.
I mean, that's a case by case basis, and that's something we would talk over with the person.
And so let's do something like, talk to me more about, so that our listeners can get a really good idea about patient advocacy. So kind of walk us through somebody's journey. Tell us how, tell us a little bit about their journey. Tell us what you did. Tell us the outcome, so that it kind of gives listeners an idea about why they want to call you down the road.
Okay, so someone was in the assisted living, was in the ER. They had fallen, and the assisted living did not want them to come back without having rehab. They felt like they did not have the level of care that person needed to come back, and they did not want to accept them back. And the ER wanted to discharge them. So basically, the person had nowhere to go. So I was in there talking to the social worker and saying, this is what the situation is. And, we just need 3 nights here, and then we can go, be evaluated for rehab. And this person really could use some inpatient rehab and it gets stronger. And I laid out their medical history and I made their case for them. And I smile a lot, and I it doesn't do any good to be demanding or
No.
be, cranky or anything. And I used to work in the med center. I know the people that are working there are, they're stressed and overworked and stuff like that. And so I have kind of a way of talking to them. And, um, I got the person 3 nights in the hospital and I got them evaluated for inpatient rehab. And we got 10 days of inpatient rehab. And they were able to return to their assisted living in much better shape. And it worked out really well because at that point, the assisted living was saying, we do not have the level of care for this person. And this person was in like no man's land. And I just did a lot of talking and just kind of laid out what was up with this person and, kind of laid out the case and their medical history and what was going on with them and kind of just chatted up the social worker and chatted up the doctor. And, it's somehow just, there's a lot of that we do, kind of, talking to different people and talking to the right people. Sometimes a lot of family members aren't even talking to the right person. They will chase down the wrong person and they don't know who, like people call me from the hospital and they'll say, "Oh, I'm so upset. I'm so upset." And I said, "Well, have you talked to the case manager?" And they say, "Case manager?" I say, "Oh, this is bad." You don't know who your case manager is. This is bad. So, yeah.
Definitely. So, so how do you handle, patients that are getting, I guess, let me try to, maybe they're getting dismissed or unheard. They're not able to, to really get the medical personnel to listen to them. So how do you come
Mhm.
into play then?
Um, I've sat in a room with a bunch of people, even administrators. I've sat in the room with the president of a hospital before and talked, so a lot of smiling again, but very insistent, kind of making my point over and over again. Um, just, laying out the facts and, but laying out the facts that are, I know, make the case, that I know are solid facts. I know what the facts they are looking for that make the case. I know that, because many times what the patients are saying is they kind of muddy the waters with like extraneous information. So I kind of dive in with the important points and what makes sense to the people that are making the decisions. So it's a matter of, trying to get to the decision makers and trying to get them to hear uh, the salient points, the important information that they need to hear. And and smiling the whole time and being assertive. Yeah.
Well, it helps to know where to go, who to talk to, and what to say.
Mhm, mhm,
And so because I look at it a lot of times, obviously, a lot of like what we did in the legal field, sometimes it's just making sure that you're talking to the right person, you're saying the right things in a way that they understand that you mean business, but too, you can still smile the whole way doing it. And so definitely. So what advice would you give caregivers trying to advocate for loved ones in a fragmented healthcare system?
stay with the bigger picture. Don't muddy the waters. If your loved one needs inpatient rehab, like my client did, that's totally what I was going for. I didn't I didn't deviate. I didn't go for anything else. You gotta go for you've just gotta be persistent and you gotta stay with what the goal is. So if the goal is that your loved one wants to go home, if your loved one wants physical therapy, if your loved one wants to, whatever your loved one needs, you need to stay with that. You need to just keep insisting and, very assertive. I say, be a squeaky wheel, but be a nice squeaky wheel. And you just need to be, and if that person is not listening, I always say, if that lever is not working, you need to push on another lever. Find the lever that opens the door. And basically, but you're just single-minded. That's what your loved one needs. You stay with that. You don't say, well, my loved one also needs this medication and that medication, but if they need rehab, if they need skilled nursing, if they need certain devices, or certain equipment or something like that. And that's the most important thing. Stay with the most important thing. Stay with that. And you can always do the secondary things later. But that's what you need to stay with. And that's how you get things done. And then you can always take care of the little things down the road. But don't say, they need another blanket, or they don't like the food, or they don't, that's not the thing. It's you're looking for what they truly need to recover, to get better, for better quality of life. Quality of life, is QOL in medical terms. That's the acronym. And that's what you want. You want a good quality of life. You want health span. You want them to have a good, healthy life span. And so whatever that takes. I remember there was one story about a man who was in hospice, and he wanted physical therapy so he could walk. And the doctor was like, well, he's dying. Why would he need physical therapy? And his family said, no, he wants to be able to walk. He may be dying, but he wants to be able to continue to walk. And they pushed till they got physical therapy so he could walk until the day he died. So
Yeah.
you can get it done if you just stay with it and you're persistent.
Yeah. When it's important to them, you have to be a very good advocate. And so most definitely. So Bonnie, this has been great. And so how do people find you if they need your services?
Okay, well, they can go to my website, HoustonHealthAdvocacy.com. They can call the number that you see on the screen. They can text me. They can belong to many different professional organizations. They can find me there. They can find me on Facebook. Let's see, they can find me on LinkedIn. You can find me all different kinds of ways. But usually texting me is a good way to find me. Emailing me is a good way to find me. I respond as quickly as I can.
Perfect. Well, this has been great. And I thank you so much for being on the show today. And we look forward to having you on again soon.
Thank you, Kim. Okay.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.